Well, yes, indeed. We'll continue focusing on the Ebola virus and what needs to be done and what is being done to ensure that it's curtailed and prevented such that there's no panic but precautionary measures. We're joined now by Dr. Sodipo Oluwajimi, who is a Senior Registrar, Department of Family Medicine, Lagos State University Teaching Hospital, LASUTH. Morning. Thank you for coming on today.
Thank you. It's nice to be here.
Well, let's start off with this part. I mean, we see lots of calls everywhere that the NMA should just please sheath your swords and get in and help out. But at the moment, that hasn't happened, has it?
Okay, thank you very much. Well, unfortunately, I'm not an official of the Nigerian Medical Association, but at least some of the latest information we have is that the Nigerian Medical Association, even the Lagos State, has set up a committee to try and liaise with the government to see ways in which healthcare professionals, especially doctors, could help in combating the scourge of Ebola. Because of the infectious nature of Ebola, you don't want a haphazard response. Because if you look through the history of how Ebola has spread, especially in Sierra Leone, in Guinea, we've seen that people that came in contact with very sick patients subsequently aided in spreading the disease. So if you have a haphazard response where people don't have these personal protective equipments, where you don't have isolation centers already set up, you're just going to allow a bad situation to become worse. So the Nigerian Medical Association is trying to liaise with the Lagos State government and other governments to try and put in a response such that when doctors and everybody finally comes back, it's in a secure way such that you don't help in spreading the virus. If you look at, for example, in Guinea, 10% of the mortality has been among healthcare workers. And by the time you now take it onto their families, you're approaching 30 to 40%. So a response has to be in place. It's not just a haphazard thing where people just rush in and say they want to.
Okay, so in the meantime, they've not suspended the strike until.
Well, the latest information I have, they have not. But I know serious discussions are still going on to try and of course, you should remember that some people have even volunteered, to try and solve the problem, even despite the strike that is going on.
So in LASUTH, which doctors are working?
Well, I won't be able to comment on that fully. I guess probably some management staff of LASUTH should be able to do that. But I know in Lagos State, as the minister has said, as the commissioner has said, there's just one center right now that is taking care of patients with Ebola. And that's somewhere in Yaba, the Infectious Disease Hospital, which was already equipped. These things have to do with training. So people that have worked in that hospital, because they work with patients that have different forms of infections in the past, already have some infection control mechanisms that are already in place. So it's easier for them to just, get into the frame of things and prevent, because the most important thing here that I need to stress is when patients are critically ill are when they are most infectious, and that is when you need everybody to have high levels of infection control, to prevent the spread of the Ebola virus.
Is there any case of any patients with this virus in LASUTH at the moment?
I don't think so. From the information I have, there's no such case. There's only one center for that, which is, as I said, the Infectious Disease Hospital, which had been managing infectious diseases in the past. Very serious infectious diseases usually go there.
But you've had some cases of symptomatic people coming to the LASUTH recently?
As I said, I may not be able to give all those details because of the ongoing strike that is taking place. But I know that mechanisms that have been put in place involve, when you say symptomatic, already people don't become symptomatic unless there's a contact. You have the primary contact, the secondary contact, and the tertiary contact. Now, in this case in Nigeria, for example, Mr. Sawyer is a primary contact. Anybody that came in close contact with him when he came into Nigeria is a primary contact. Now, the people that now came in contact with the people that came in contact with Mr. Sawyer, maybe family members, as we're just watching the news now, they talked about some ECOWAS staff that may have come in contact with the aid and all those kind of things. They become secondary and then tertiary. So I know the government is monitoring all the primary contacts or people that came in direct contact, and subsequently other people too that may have, when one person now becomes symptomatic, he now becomes a primary contact to other people. So they are monitoring those initial 70 people, by checking their temperature twice daily and all that. But in terms of symptomatic patients coming to LASUTH, I can't categorically state that.
Now, as a doctor, what are your thoughts on this particular disease?
Well, Ebola virus is, it's one of the hemorrhagic fevers. And funny enough, there are over 30 hemorrhagic fevers. And we've actually had some in Nigeria. You know, we have Lassa fever, which is endemic to certain parts of the country. And we've had yellow fever, which has almost been eradicated with vaccination. You know, but Ebola, because of the fact that it is not curable per se, it's not treatable, what happens largely is supportive care. So, of course, it's a very serious condition. But again, the most important thing is for people to understand the mechanism by which it is transmitted so that you don't have a panic-like situation. Because once you have a panic situation, an haphazard situation, it's only going to help to worsen the situation. It's not going to help to solve it. So I think one has to commend the Lagos State government and, of course, the federal government for some of the measures they started putting out and trying to get information out to people about how it is transmitted. Of course, we know that Ebola being a viral, virus just means that's the organism that causes it. Fever means high temperature, somebody having a very high temperature, and then hemorrhage means bleeding. And that's the progression that it goes by. So, unfortunately, because of the fact that fever is a very common symptom in Africa, in Nigeria. I mean, everybody has had one bout of fever this year. It could be malaria, it could be typhoid, it could be some upper respiratory tract infection that caused it. And, initially Ebola starts with fever, then weakness, then, you start having upper respiratory tract infections like cough, catarrh. Subsequently, it progresses to having GI symptoms, that's vomiting, diarrhea, before you now have bleeding, and then subsequently, if the person is not properly managed, death. Now, because of the fact that some of those symptoms are common symptoms, there's this likelihood that, one, the diagnosis could be missed. There's also the likelihood of panic, because if you go around the community, especially with the cold weather, one person is having a form of cough and catarrh. One person is having some fever somehow. But the most important thing that we're trying to get out is that, number one, for Ebola to be spread, there has to be a history of contact. Now, that contact means coming in contact with, probably, it's not necessarily someone that is even, someone that traveled recently. So once you have this history of someone that traveled to some West African country recently, of course, it should raise that index of suspicion that maybe this person could, be a carrier. Secondly, people that probably are already ill, and that is when it becomes more infectious. Now, the advantage, the only good thing we can just say about Ebola is that it doesn't become infectious immediately. If not, probably it would have been worse off than where we are today. As the person becomes more ill, so the person becomes more infectious. And that's why, and they've seen that some of the most infectious fluids include the vomitus, the stool, and blood.
What about sweat?
Sweat too is also infectious, saliva, but the most infectious ones are those ones. And of course, as the person becomes more ill, it becomes more infectious, even up till death. And that's why even in some African countries, the people that have helped in carrying a dead person come down with the infection. Because once the person is very infectious, there are so many mechanisms by which the virus could now get into the body. There have been talks about contact with the skin. Because yes, there may not be any breakage, physically, on the skin, but some people have talked about micro breakages. You're under the hot sun, there could just be a little breakage that you may not know has occurred on the skin.
Because that's why they say if you touch,
exactly,
wash your hands.
Wash your hands immediately. Secondly, the issue of, we have this practice, people touch people, you touch your face, touch the mouth and all those mucous membranes, they easily absorb things. So before you know it, that's how the virus has spread. But I think the biggest problem that we have is to prevent this fear factor where anybody that just has a fever, people are pushing him out. Because, again, you want people to come forward once they develop symptoms and have that history of traveling. See the case of Mr. Sawyer. There are unconfirmed reports that he was probably ill, but somehow he escaped and came to the country. Now, you don't want such situations. You want situations where people fall ill, go to the hospital or go to the government-recognized health centers that are treating this thing, and subject themselves willingly to tests. Because studies have also shown that people that start treatment early at least have a better chance of survival. So, all in all, I think, it's going to take a collaborative effort for everybody to get this thing sorted out.
Do you see panic? Sorry, Nyota. Do you see panic already setting in from our reaction?
In fact, there's a lot of panic. I was coming in you know, and I tried to shake somebody. And of course, the response was yesterday.
I noticed that you didn't even attempt to
Yes,
shake
I
her.
Yes, I did. And even yesterday, I visited some people, and somebody just took a cloth and, you know, used that. And again, there have been so many misconceptions and rumors going around. I mean, this morning, people have been calling about this issue of salt and water, you know, that it helps to prevent the virus. And the problem with misconceptions is that it just drives, people will now not get on to the real message of how to prevent the virus. For example, the issue of salt and water, I just told somebody that if you were to take salt, and you know, in Nigeria, people have this aggressive way of taking their bath, you could cause those micro breakages on the skin that we're even talking about. So you're increasing the chances of even getting the virus. And then you could even have elderly people that are probably hypertensive or something. They're taking so much salt to try and prevent Ebola. They come down with a stroke. Again, some people talked about things like bitter cola.
That's one frying pan to fire.
I mean, we're just worsening the situation. What we need to be doing is trying to control the spread of the virus. Because we have the disadvantage we have is that, unlike in other countries where the virus has gotten into rural communities, you know, if you look at the history of Ebola, when it started in 1976, so many people that got infected died. But they were in the rural community, so everybody there just died off. Unfortunately, if you're in somewhere like Lagos, you have, 20 million people, and people are traveling, people are going all over the country. So it's more difficult to control it. But I think with simple basic hygiene and a high index of suspicion, probably we could get on top of the situation.